Many children with autism are on some kind of medication, and many young children with signs of autism, their parents wonder if medication might be appropriate, when it's appropriate. Today, we are sharing a small snippet from a podcast that we recently rebroadcasted, podcast number 180 with Dr. Michael Murray. It's a great episode and a great little snippet for you to think about more about medication and autism. I'm Dr. Mary Barbera, autism mom, behavior analyst, and best-selling author. Each week, I provide you with one of my videos to help you turn things around, whether you're a parent or professional. If you haven't subscribed to my YouTube channel, you should do that now. Today, we are sharing a small clip from podcast 180 with Dr. Michael Murray, here to give some wisdom. Let's check it out. There seems to be a lot of confusion and controversy over treating kids with autism with medication. In general, what are the symptoms and issues that kids and adults with autism take medicine to treat? What in your experience has been the common issues and the common things that medications are prescribed for?
Sure. So there are two medications that have FDA approval for treating conditions related to autism. So there's no medication for the core symptoms of autism. I think that's really important to understand. We have not evolved our understanding of the causes or the pathophysiology of autism to the point that direct medications to target those core symptoms. So everything that I will talk about for the remainder of our time together is talking about the issues that are kind of circle around autism, like so some of the things that kind of go along with it, or are means of dampening some of those core symptoms to allow other treatments to become more effective. So like behavior analysis, right? So sometimes you are having someone in such a state that they're not able to learn effectively, and really kind of creating an internal sense of calmness or relaxation so that the behavior strategies or trying to teach new skills has a better chance of being successful. But the two medications are, you mentioned them, are Ariprozaol or Abilify and Risperidone or Risperdal. And they both have indications for treating severe mood irritability, severe aggression, and severe self-injury. But they would not be the pattern that you were describing for Lucas, right? It would be the pattern of having them very frequently every day, to a degree of really concerning levels for safety of the individual or those around them. So really, if you're thinking about those medications, we would be really looking for frequent occurrence of these behaviors across settings, to a high degree of intensity, because as you also mentioned, they do have side effects which are concerning. So it's really needing to do a very careful cost risk benefit ratio in trying to make sure that there's enough potential benefit to justify the risk that you are going to take on by utilizing these medications. However, just because there's only two that have this FDA approval doesn't mean that we don't use other ones and can use them quite effectively. So I think it's important for professionals listening and for families to listen who are listening is just because someone has autism doesn't mean that they can't have any of the other things that we could all suffer from as well, like depression, like anxiety, like ADHD, right? So people with autism have those things, and in some cases they have them more commonly than people who don't have autism. So, those are the things that we're frequently monitoring folks for. Particularly as people age, there's much more likelihood of them developing depression, much more likelihood of them developing anxiety. So we want to make sure that we are looking at those things. Are they developing to a degree of severity that really maybe a medication can be helpful for them? And then, there are, like we were just talking about a minute ago, is really kind of thinking about things that may be interfering with other types of treatments. So, if you have a really effective behavior strategy, or, you feel like you've kind of gotten to a certain degree and now you're plateauing, and now, what can we do to try and keep the progress going, those are sometimes we think about, situational anxiety, right? So is the anxiety progressing to the point in a demand situation where, new skills or new environments are being, the person's being exposed to those, that the anxiety is rising to the level that's really interfering with them continuing to participate in learning and persisting through that. So sometimes we're looking for medications that are just meant to augment the other treatments, that are making the other treatments more likely to be successful. Obviously, anytime you're looking at a medication, you want to do a very careful analysis of what you think the potential benefit is versus the potential risk of being exposed to that medication. And I love working with behavior analysts because you can always, say, okay, let's think about what this is going to look like behaviorally. So this is what I think is going to be happening in the brain with me utilizing this medication or in the body. And, so if we think about what this is happening internally, what is it going to look like externally, right? So what do we expect to go away, right? Is there interfering behaviors? Are there challenging behaviors? Or vice versa, what are skills that we think are going to progress more rapidly or start to emerge? So kind of looking at a very kind of, having clear operant definitions of behaviors that you expect to change as a result of the medication exposure, and then working with them to, okay, how's the data going to look? How often are you going to collect the data? And I think also kind of working with a psychiatrist also can be really helpful, in asking what is the expected window of activation for this drug, right? So if the medicine's not expected to work for 4 to 6 weeks, taking data in week 2 isn't really informative. I mean, unless you need the data for something else, but if you're looking at it for just looking at efficacy of medication, it's too soon, right? So, if you got good baseline data, then you need to wait until week 4. So, I think it's just kind of having that dialogue between the behavior analyst and the psychiatrist is really important and I think impactful in each of them doing a better job. So
I hope you enjoyed that small clip. If you did and you'd like to watch the whole podcast interview, it is marybarbera.com/180. If you like this, leave a comment, give a thumbs up, or share it with somebody else who might benefit. And I'll see you right here next week.